Let's dive into something really practical today, navigating this first few weeks after a brachial artery thrombectomy. We're looking at post-procedure care instructions.
That's right.
Our sources are basically a discharge protocol and some related notes. Think of it as the guidebook for your recovery at home. And our mission is to pull out the most important bits for you.
Okay, but first, really important, there's a legal disclaimer in the source material I need to read verbatim.
Please do.
It says, legal disclaimer. This is a discharge protocol written by Dr. Gregory Weir for patients managed by him at his practice at the Life Eugene Morez Hospital. The contents should be discussed with your own doctor and should not be considered as advice if you're not a patient of Dr. Weir.
Right, crucial context, thanks.
Yeah.
So keeping that firmly in mind, let's focus on the guidance itself. What are the immediate physical things you need to know? Protecting that arm must be key.
Absolutely. Arm position is paramount. The protocol is very specific. Do not bend the arm, the one that had the procedure, more than 90 degrees.
Okay, 90 degrees max.
Yeah, and try to keep it as straight as possible, especially, say, if you're a passenger in a car. And another big one, elevate your arm. Keep it above the level of your heart whenever you can.
Ah, elevation. Helps with swelling, right?
Exactly. It uses gravity to help reduce swelling and improve drainage.
Makes sense. What about just general activity? Moving around?
Yeah.
Driving?
Good question. The protocol says explicitly you are not allowed to drive, period.
Okay, no driving.
No. And it also advises avoiding strenuous activities. Rest is important. Let your body focus on healing that artery.
Got it. So physical limits are pretty clear right after. How about caring for the actual wound site? That seems critical.
Oh, definitely. Wound care has some very specific instructions.
Yeah.
First off, do not shower or get the wound wet.
No water at all on the wound.
Correct. Keeping it dry is vital to prevent infection and help healing. Also, avoid putting excessive pressure or tension on it.
Like tight clothes, maybe.
Yeah, exactly. Or bumping into things. You
Yeah.
need to keep it covered with an absorptive dressing, and you replace that dressing every 3 to 5 days.
Okay.
But there's a but here. If the dressing gets soaked through, saturated before that 3-day mark,
Yeah.
you need to replace it immediately and phone the consulting rooms to let them know.
Right. That sounds important. What about medications? That's usually a big part of recovery.
It is. And the protocol stresses strict adherence. Don't miss doses. It mentions often combining an antiplatelet drug like aspirin with another called clopidogrel. These help stop new clots.
Standard practice often.
Pretty much. And if you were already on a blood thinner, like warfarin or rivaroxaban before the procedure,
Mm-hmm.
you usually continue that afterwards, but always follow your doctor's specific instructions. Oh, and also really important, keep taking all your other chronic meds, blood pressure, diabetes, cholesterol, all of that.
Don't stop the routine stuff.
Okay.
Got it. Any other simple tips mentioned?
Yes, actually, staying well hydrated. Drinking enough fluids after the procedure can apparently help reduce the chance of complications. Simple, but effective.
Good hydration. Always a good tip. Now, the flip side. When should you worry? What are the red flags?
This is crucial. The protocol says contact the consulting rooms immediately if you have any symptoms related to the arm or problems with the wound.
Okay, like what specifically?
Well, they list things like a sudden onset of pain, any new swelling, losing sensation or feeling, weakness in the arm or hand, discoloration.
Discoloration, like the skin changing color.
Yes, or bleeding from the wound site. Also, neurological symptoms, maybe sudden numbness or tingling that wasn't there before. Or really any sudden changes that concern you. The key phrase they use is, when in doubt, phone the consulting rooms. Don't wait.
Clear message. Don't hesitate to call. Okay, so beyond emergencies, what's next? Follow-up appointments.
Yep, there's a planned follow-up. It says you'll have an appointment at the rooms, prearranged, usually within about 2 weeks after the procedure.
Good to know there's a check-in scheduled. And thinking longer term, does it mention lifestyle changes, preventing future problems?
It does, yes. Long-term maintenance is covered. Daily exercise is encouraged. Walking, cycling, swimming are mentioned specifically. They help strengthen calf muscles and improve overall circulation. For the arm itself, you gradually increase its use. The goal is to resume a full exercise program, including the arm, after about 4 weeks.
Okay, gradual return to activity.
Right. And 2 other big ones. Weight control is called essential long-term. And smoking cessation, absolutely essential.
Quitting smoking is always high on the list for vascular health.
Always. They even suggest medications like varenicline or bupropion might help if just trying to quit cold turkey isn't working.
So it's really a whole journey laid out: immediate care, meds, monitoring, then shifting into long-term healthy habits. Thinking about all these detailed steps, from carefully positioning your arm and managing the wound to the essential medications and those big lifestyle shifts. Here's a thought that strikes me. What does following such a specific, targeted protocol like this really tell us about the connection, the partnership maybe,
Hmm.
between advanced medical care and the absolutely vital role you play in your own recovery and ongoing health?